Hello, this is Isabella Smith, and today we're going to be talking about why it's important to follow a doctor's instructions. Following doctor's instructions makes it possible for a person to live a life of good health. Brittany McInturf is a sophomore in nursing school and has already seen the truth of this.
Hi, my name is Brittany McInturf. I'm a PCT at Holston Valley, and I'm a nursing student at Walters State. Being in the nursing profession, I see firsthand how important it is to listen to your doctor. Disorders or diseases such as diabetes, mellitus, if you're not following your doctor's recommendations such as lifestyle modification, and that's when you're going to change your diet, you're going to change the way that you take care of yourself, you're going to stop smoking, anything that's damaging to your body, you need to follow your doctor's guide and stop doing those things. And if you don't, I have seen firsthand the repercussions of not following these orders, such as you are at risk for losing your limb, an amputation, ulcers. You're at risk for being in a diabetic coma. All these things are a huge factor of whether or not you listen to your doctor and you follow his strict guide, or you keep living the lifestyle that you are. It is possible to live with these disorders such as diabetes and be happy and live a fulfilling life, but only if you're following the guide of your doctor. And with that being said, I think it's very important that you always follow your healthcare professionals' guides and rules.
Mary Lou Hayes knows the importance of following the instructions of a doctor because of her daughter. If she fails to do what the doctor tells her, her daughter's health could deteriorate quickly.
Hi, I'm Mary Lou Hayes. I'm the mother of Chloe Marie Hayes. When she was born, she was diagnosed with microencephaly and schizencephaly. She is currently blind. She cannot walk, talk. She will be 4 years old, August the 12th, and she may never walk or talk. She has multiple therapies and multiple doctor's appointments. Her therapies are physical therapy, speech therapy, and occupational therapy. If we don't keep up and continue with these therapies, she may not be able to do anything. You have to constantly keep a check on her sugar. If she goes to an endocrinologist, or not her sugar, her diabetes insipidus. And diabetes insipidus is high or low sodium. It has nothing to do with the sugar. But if it gets too high, then she wets a lot. She gets extremely thirsty. If it gets too low, she just wants to sleep all the time. So we have medicine to regulate that, where it'll stay where the normal place where it's supposed to be.
Vicki Miller has been a nurse for the past 30 years. She has seen patients go on to lead healthy and happy lives because they listened to their doctor and were diligent in doing what they were supposed to, and those whose health slowly worsened because they did not change their lifestyle.
Hello, my name is Vicki Miller. I'm a licensed practical nurse. It's very important for patients to listen to their physicians and do as they are told. There's reasons behind what they need to do. There is long-term illnesses such as diabetes and asthma and COPD and other lung disorders that if you do not follow directions, you can get a lot worse and not live quite as long also. Medications, like if you're ill and you're on antibiotics, some people tend to only take a few till they feel better, and then they end up getting another infection later, which is actually stronger and harder to get rid of if you don't follow through and take all your antibiotics like you're supposed to. You need to, if you're diabetic, you need to monitor your sugars, you need to watch what you eat, you need to exercise, you need to check your feet for any kind of sores or anything like that frequently, and if you don't, then you can have a lot of difficulties and troubles.
All three show how listening to a doctor can improve a person's life, especially for those with lifelong diseases and disorders.